In this episode of Pharmacy Pearls, we'll do a basic overview of the medications available to treat Alzheimer's disease, and, as a thank you to my viewers, I'd like to offer you a free pill splitter. Just pay $2.95 shipping. Visit pharmacypearls.com/splitter to claim yours. Alzheimer's disease is a type of progressive dementia affecting both cognition and behavior. It destroys parts of the brain responsible for higher learning, memory, reasoning, behavior, and emotional control. Unfortunately, it has no known cause or cure. At first, symptoms of Alzheimer's disease are almost imperceptible. The patient may have vague memory complaints, or a spouse may report that their partner is forgetful. Deficits progress over time, and behavioral disturbances may begin to occur during moderate stages. Patients with Alzheimer's disease eventually lose all cognitive, analytical, and physical functioning, and the disease is ultimately fatal. While patients with Alzheimer's disease experience many examples of brain pathology, two are of particular importance when it comes to available drug therapies. First, there is substantial cholinergic cell loss and damage to cholinergic neuronal pathways, resulting in a deficiency of the neurotransmitter acetylcholine. Second, excitatory neurotransmitters, such as the amino acid glutamate, are believed to exert toxic effects in patients with Alzheimer's disease. Unfortunately, the search for novel Alzheimer's disease treatments has so far been to no avail, with Pfizer announcing a halt to new drug research in January 2018. As a result, we are left with only two types of drug therapy options. The main class of medications for the treatment of Alzheimer's disease is the cholinesterase inhibitors. They include donepezil or Aricept, rivastigmine or Exelon, and galantamine or Reminal ER. These medications work by blocking the breakdown of acetylcholine by the enzyme cholinesterase. This increases the availability of acetylcholine at cholinergic synapses. Ultimately, the medications attempt to improve or maintain cognition and function by mitigating the impact of cholinergic cell loss. The benefits of the cholinesterase inhibitors are small to moderate on average and consist mainly of disease stabilization. Expect some symptoms to improve, others to stabilize, and still others to worsen. The efficacy and tolerability of each medication varies among patients. Those who do not respond to one agent may respond to a different medication of the same type. The best available clinical evidence suggests that for every 10 patients treated with a cholinesterase inhibitor, one will have a clinically meaningful impact that they or their family members are able to detect, one will have to discontinue the medication due to adverse effects, and 8 will not experience any benefit whatsoever versus placebo. Remember that symptoms of Alzheimer's disease fluctuate, and patients will have good days and bad with or without treatment. Before starting Alzheimer's disease medications, one should clearly define goals and target symptoms, and then carefully monitor at regular intervals in order to determine treatment efficacy. For example, instead of stating that a patient's cognitive function is impaired, specify that the patient is unable to carry on a conversation or only calls one or two well-known phone numbers. For many symptoms, it is necessary to quantify how often they occur. Knowing that a patient asks the same question up to 20 times per day is more useful than simply stating that repetitive questioning occurs throughout the day. The most common adverse effects include nausea, vomiting, and diarrhea, headache, dizziness, bradycardia, and insomnia. Donepezil has the advantage of once-daily dosing and may be associated with fewer adverse effects. Remember that patients in more advanced stages of the disease may be less able to express when bothersome adverse effects occur. Because of this, side effects may go unnoticed without careful monitoring by family members and the healthcare team. Dose adjustments may be made at 4-week intervals. Try to avoid using anticholinergic medications, as these antagonize the effect of cholinesterase inhibitors. Heart rate and blood pressure should also be monitored in patients also taking beta blockers or calcium channel blockers due to the possibility of additive bradycardic effects. The efficacy and toxicity of donepezil and galantamine is influenced by substances, such as grapefruit and other medications, that affect liver enzymes responsible for drug metabolism. Donepezil should be administered at bedtime, but can be switched to the morning if sleep disturbances, such as nightmares or vivid dreams, occur. Remember that galantamine is an extended-release formulation and should not be chewed or crushed. Finally, rivastigmine, which is also useful for dementia associated with Parkinson's disease, must be given with food. The second option for treating Alzheimer's disease is a medication called Memantine, or Ebixa. It is classified as an N-methyl D-aspartate, or NMDA, receptor antagonist. The neuronal cell death associated with Alzheimer's disease results in the release of glutamate, an amino acid and excitatory neurotoxin present in very high concentrations in the central nervous system. Glutamate then binds to the NMDA receptor, resulting in further cell injury and death, and the cycle continues. Memantine, through NMDA receptor inhibition, blocks glutamate-induced neuronal toxicity. It is used either in combination with cholinesterase inhibitors in moderate to severe Alzheimer's disease or as monotherapy. Memantine is generally well tolerated, but adverse effects may include dizziness, headache, confusion, constipation, coughing, and hypertension. Titrate the dose at weekly intervals, and remember that lower doses may be required in patients with renal impairment. There are no reported drug interactions involving memantine, though in theory, urinary alkalizers may reduce its clearance. Ultimately, where memantine is concerned, its effects are small and inconsistent. Thank you so much for watching. Next, test your understanding of the material covered in this video by taking the review quiz, available by clicking here or in the video description below. Before you go, please show your support for Pharmacy Pearls by subscribing to my YouTube channel. You can also follow me on Twitter @PharmacyPearls. Take care.